of shoulder mobilization, you can do two things. Why don't I bring one of the... So let's look at the anatomy. First, you can mobilize the shoulder joint itself, which is in between the humerus and the scapula. Yeah? You can do that movement, yeah? Which would be here doing that movement. Yeah? Another thing you can do is take the whole scapula and move it. Now, because the scapula is actually screwed to the ribs here, we can't do. But in real life, it will be doing that movement. Yeah? Or that movement. Do you see the difference between that one and the shoulder joint itself?
Is that comfortable?
Yeah? So you have to choose what do you want to do. I would suggest first, let's do the scapular movement. So you need at least 3 points of attachment. So one would be 2 here, 2 positions, and the third one is with my hands over her arms. I would also add my hands here. Now that hand, my right hand, I can assist with the movement, or I can do massage while I'm doing it. Yeah? Now let's talk about my position to start with. So I need to have the 3 points contact, and then I need actually to move. All I need to do is really move my weight from one leg to another one. As simple as that would be actually having an effect. Not moving my torso, but actually moving my whole body. So take it up into something that would be a bit better for your body, is to bend your legs and then move from one leg to another one. And I want you to practice just that to start with. Feeling that you are holding her comfortable, that you're not losing the contact. Because if you start being not confident, the client would feel it and start to help you, assist you, and the idea of them to relax. So you can do nice laxity onto the upper trapezius and nice stretch. If you want to enhance it, you can ask the client to turn your head, and it would make the stretch even more. You can keep the stretch nicely, and then it's nice to work on the muscles here when it's stretched and when it's laxed. It would improve the blood circulation, I don't know, a few folds, because it creates that squeezing and opening and squeezing a lot more than just doing the compression. You can keep it squeezed into lax a little bit. And not only here on the upper trapezius, but also you can lift the shoulder and then work on the erector spinae muscle. So where would be my hand? I can do that holding that arm, and I can work on the upper trapezius, but also around here, around the spine here. And it's quite good because the moment you start moving the shoulder, you have an effect on the spine also. Try to find this effect on the spine and how your movement can actually soften that area also. So it's not only shoulder really. You can work here, you can work on the suboccipital area, yeah, on scalenes, rhomboids, and teres muscles on the side here. So how would it look like?
Would you prefer to do it this way than with them lying the other way?
Yes. I tell you why. Because when they're lying the other way, whenever you lift the shoulder, that's what happened.
I think that's right.
Yeah? Can you actually come and lie on your turn this way? Oh no, continue on your back, on your front. On your front all the way. On your front, thank you. Good. Now, put your head to the side. Good. Can I have now the arm? Yes? Now, what we saw a lot in your exam is that. Why? Because it's comfortable. You don't want to go down.
Oh, so you can do it like that?
You can do it, but what happened, this is not the appropriate way to do it. Because what you do is actually increase the problem, yeah, rather than stretching it. Yeah, you can do it this way. Can you turn the head to the other side? You can do it, but you have to do it a lot more skilled. It's a lot harder. The hand should be lower, and then yeah. Or you can do it this way, and then mobilizing it. There is great technique this way, but we don't want to see that. Yeah. On clients, on Alicia is okay, just okay. On other clients, it will cause them backache, neck ache, shoulder ache. Yeah? Not very good. So that's what we're saying. Let's start with the easier one. Okay? Come and turn around, please. Turn this way.
Oh, laugh, you won't help.
Okay, so we're coming back to here. I prefer to you to do it without oil to start with. Okay, so again, I want you to do the upper trapezius. Yeah, I want you to stretch, and I want you to put it into a lax position. Good. You can then do circles. You can do circles the other way. You can massage in a lax position, even the suboccipital area. You can work underneath the upper trapezius. Here, I feel actually the tip of my hands, the tip of my fingers are on the spine. Yeah? If I'll do that, the tip of the fingers are on that side of the spine. Okay? Shall we start with that? Let's do it.